Okay, let's try this again. Come on, are you starting? You are now live. Okay, let's take two. So, this morning's medicine is antimonium sulph auratum. And that is sulfur. What the heck is it? Golden sulfuret of antimony. What is that? I don't know. I didn't look it up. It don't matter. What it's good for is lungs, eyes, skin, some different things. What's it say? Anyways, it's on there. So before I start under that, I wanted to just, homeopathy. Don't get. It's not the easiest medicine to take care of. To utilize. It can be for acute situations. Chronic situations, it can be a little more difficult. The idea is you the medicines work. It's the case taking. It's getting the symptoms out of the people, knowing how to talk to them. Now, there is simplicity to it. Arnica for head injuries and that, any kind of trauma. Calendula for cuts, wounds, and all that stuff. Bryonia and Russ talks for back problems and pains and aggravations that are better by motion, worse by motion. Russ talks is better by motion. Bryonia is worse by motion. So there's different keynotes that you keep in your mind. Now Hahnemann, in his time, he was a doctor and he was using all the medicines. They were using mercury. They were bleeding people. All this stuff, kind of like today. Irradiate you, give you these drugs that'll, one end that'll take care of that eczema. On the other end, you could catch a lot of other stuff because your immune will be lower. So there's a trade-off there. Is it useful? Yeah, antibiotics. I took my kid to get antibiotics when I totally forgot that he had cats. He got cat scratch fever. He got scratched by a cat, and now he's got this flu type symptoms. And I'm thinking, okay, you got the flu, no problem. And then he got a rash, and I'm like, what the heck is this? Is this scarlatina from having strep and then a flu type of symptoms? And now he's got scarlatina. I didn't know. And you know what? I didn't take a case with him because my son, I just going off of what he said, a flu. And that's what you don't want to prejudge anything. You want to be an unprejudiced observer. So if I would have remembered, oh yeah, that's right, or went back, well, when did it start? Oh, I got scratched by it. What has happened to you? An etiology or a cause was cat scratching them. So that could have been real easy. I would have gave him medicines for that. I was giving him flu medicines, so now I'm off the center of the mark. So Hahnemann, he was given all them drugs and that, and he decided, he quit. I don't know if it was 10 years. I forget how many years. I think it was 10 years. And then he started going out and an experiment. Now they were saying, okay, Chicona bark, it's healing him because of the cost, astringent properties or this or that. They were conjecture of why, guessing basically. And he said, let me try something. He took the tincture and he got malaria symptoms. So he realized whatever will make you sick will cure that same sickness no matter what it is and anything. So that's why we're not, whether you got a flu or you got an infection or you got whatever, these medicines can work depending on, and it doesn't matter what you have as long as you get the symptoms out of them. Like my wife, I'm having a hard time with her legs. She shakes them. I got so many symptoms and I've got medicines that I keep trying. And then the other end of it is the potency. Sometimes you hit, it doesn't, you just start into there. And I found with doing it in water in bottles, you start into it and have them take it every 15 minutes and eventually it's either working or it's not. And if it's not working, then you got to go to a different medicine. So, and a lot of homeopaths still, I read out of these books and they're like, I gave 5 remedies. And I talked to the guys in the UK. They give a bunch of remedies and they realize, man, I'm not able to hit it. And then one day they finally get a small medicine like this for lungs. This is good for nasal catarrh, bronchial stuff, bronchitis. They give that medicine and it clears it up. So that's kind of the hard part. Now, Hahnemann, what he was doing is once he found that out, he started experimenting. And then once he experimented, he would take a medicine, make it up, all these, and then the other doctors that kind of like said, yeah, this stuff, they use it like I did. And, for my kid's eyes swelling shut when I brought a dog home, swelling went away. He's never allergic again. I said, wow, this does work. Those doctors that did utilize it and got the symptoms or got the cure for the whatever disease they were dealing with. Now he did cholera. He was very, saved a ton of cholera. Next time, they were all dying from it. But and then once these doctors realized this, they started coming aboard. Now, the allopaths who wanted to hold on to, we are the doctors, we wear our white coats or whatever they were doing in that day. You come to us, bow down to us, we'll give you this medicine. It's going to do some damage to you, but it'll take care of those symptoms you have. Maybe make you function. But the side effects can be quite detrimental, as you can see when these people are dancing on the TV and they're like, "Yay, we're all happy from taking this whatever it is, Ozempic," or they got a lot of them that they keep inundating you with. But at the end, it's like you have this, that, this could go wrong. Doesn't mean it will go wrong. Some people may be okay. Just like vaccinations, 1 out of 100 may end up with autism, or may end up with, and I'm not getting into that whole controversy, but may end up really detrimental from the vaccines. So Hahnemann in his day, now he's doing this, using it, took care of cholera. I imagine that made them doctors jealous. That's the same thing like with the measles going around now. You take me down, send me down there. You don't even have to send me down there. I just tell them, take marbelinum, give it to everybody. Marbelinum is the measles disease. Give it to everybody in a bottle of water. That will act like a vaccination, and that will be a prophylactic to them getting the disease. The other ones who have the measles, what's the main symptoms going on, and then you can fix it. There's a handful of measles remedies. So anyways, he's doing this, and he's malaria, and I think a major flu that came around. He single-handedly took care of all that. The other times they were getting sick and not faring well with it. So I imagine these doctors got jealous and they started attacking him. And he even gets in there and starts attacking back in the Organon. And this is his always experimenting and his ideas and his thoughts and what was going on. And he said, these doctors, and that's why I say this is hard. This can be a hard medicine. You have to think more. You have to, you don't have like, I mean, all these medicines they do on TV, these guys are like, I imagine a guy coming in and saying, "Hey, do I need this medicine?" The doctor's got to kind of know all this stuff, but it makes it easier. They don't have to really think about it. They know this medicine does this medicine does that. We give this, we give antibiotics for everything, whatever bacteria, whether it's bacteria or viral, and it doesn't work on viral, but give them that anyways. Instead of, you can just send them home with a sugar tablet and say, "Yeah, this is going to work great," and the person won't know any different, and you won't do harm. But penicillin can do harm if you overuse it. And they're saying these bugs are um, super bugs now. No, the immune system of the person's smaller. The bug just changes a little here, little there, little here, little there. If the immune system doesn't change to fight it, it doesn't keep up. So they seem like super bugs because the antibiotics ain't working. The people can't overcome it. Whereas, and that's what Kennedy's doing now. He's in the idea that if you get measles, you'll get through it, and it's done that. Like the Amish, I don't think they take it and they get through it. So, anyways, Hahnemann is fighting with these guys, and he turns around and he starts saying, these doctors who start using homeopathy, and they realize it's a lot harder because, heck, all I used to do is just, everybody gets mercury, everybody gets bled, everybody gets, this is all we have, this is what we do. Now with homeopathy, they have to take cases, they have to think about it. So he calls them some name where they decided it's much easier if I just go back and I just give all these chemicals, and I know which chemicals. I don't have to think about the case. I don't have to learn these medicines. I don't have to know what's going on. So he fights back, and basically he has to leave Germany. He goes to France. So so now good for France, because now France got this guy who's really got a medicinal. And what he did was he said, I want to find the perfect medicine, I want to make it perfect. And his last experiments were LMs. They were deeper acting, they were in water, and they were no aggravation. Where before they were just giving real high doses, aggravating everybody. Then when they'd come back down off of that aggravation, they would be a little better from whatever they had. So he kept experimenting, trying to perfect the medicine. So now he's not only can you make up this substance, you can take a bunch of people and give it to them, have them report back their symptoms, write the symptoms down, make up a book like so, to the materia medica, to know what the medicines are good for. And then you have a repertoire that will say these medicine, if you have this sickness, you have this headache or this thing, under that, these are the medicines it could be. Now it's up to you to take the symptoms out and do it. So I always wonder, why God did you put me into this? Why did you give this to me? I came to it, I was searching for a church, and I said, God, you want me in a Catholic church, Pentecostal church, or where do you want me? Because I just love the Lord. I love reading the Bible. And he sent me to this place through my marble business, which was Adonai marble restoration, which Adonai means the name, that is the Lord. That's what that means. So anyways, I came there, saw verses on the wall. I said, oh, you're believers. Yeah, we meet this day and that day. And I had another meeting that night, canceled, went over there, said, man, this was the answer to that prayer. Through that lady turned me on to homeopathy, and I'm studying. I'm like, yeah, okay. And eventually I said, my kid's eyes swelled shut. And when I brought the dog home, I said, let me go see. I ran out to the GNC, got a homeopathic remedy, was a combination dog hair remedy, probably 20 remedies in there. And you can do the same, sinusitis, allergies, whatever. So I got that, brought it home, gave it to him, I think in a bottle of water. I'm not sure. I might have just started giving, yeah, I think it was a bottle of water. He took it, swelling went down in a couple hours. I don't know how long, to be truthful. And then it was no longer allergic to a dog. I said, man, I got to study this. And that started this 30 years ago. That's 30 some years ago that started this. Now, it can be easy to the point where I got, person got in a car accident, arnica right away. It could be aconite because of the fear. Depends on if the trauma hurt them worse or the fear of the accident hurt, is bothering them worse. So there's a few nuances, but usually you just give arnica, and that, the person feels a lot better. Um, like my wife's, and then, like a hernia. What do I give for that? I don't know. I don't have nothing in my mind. It's painful. Not helping. I go into the book, look under abdomen, hernia, and then I come up one on the right side. That's all I had was right side. Right and left side always matters. What's it feel like? All those kind of things matter. Right sided hernia, like a podium, gave it to her. I don't know. I remembered a couple of days later. I said, how's your hernia? She said, oh, it's gone. I'm like, it still freaks me out. That can work with a little sugar tablet that has no substance in it. So we go from the zero, the allopaths use the substance. We go zero. We go to negative. It's got to be quantum physics, because we understand the big world with all the molecules and all that, but we do not understand the quantum realm as well. They'll say it even. Einstein, said this is spooky action from a distance, when two particles can be as far away as ever and they interact with each other. The spin, if you change the spin on one, it changes the spin on other, no matter how far away it is. So that's, we can't explain a lot of things. And the lady asked me, can you explain this? Not really, but it's got to be a quantum thing, and it's reacting with your vital force. We know spiritual things not so well. But Hahnemann kept experimenting, kept working on this, fighting with these doctors, and the ones that actually utilized it and, were persistent at it, because sometimes I would imagine they had patients come in, they'd try to give it, and man, they just couldn't find a medicine. So they just went back to the allopathic medicine and gave it to him. So he called them, I don't know, mongrels. I don't know what he called them, but, he had to fight, because they were fighting him. Same as the day we're being fought, why they don't integrate it into their thing. Now the Hint, another homeopathic group I'm in, they talk about they're starting to use something calling smaller doses. They don't want to call it homeopathy, because then they'll say, oh, we agree with those guys, but they're calling it smaller doses of things. And there's, so they're experimenting with the whole realm, and they're going to If they take over on it, that's fine, and they start utilizing the homeopathic principles to cure. That would be great. But people are going to be losing their health insurance in that. I don't have any, you know. And when I did have it, I had $900 a month for me and my wife, and we never used it, And if you went in to use it, it still cost you more money. So yeah, quite expensive stuff. Yeah, this is inexpensive, and it's quite effective, and no side effects. So if you do give a medicine, it doesn't work, it's not gonna harm them. When you first start, to get a couple books, probably 100, 200, maybe $500, and you're set up. You got a kit, you've got the books. Now you can start utilizing it. Um, if not, that's why I build a community so people can come in and start learning. And I'm gonna do a webinar. I think what I'm gonna do is I don't think I'm gonna. I may do a little teaching, but I'm more or less I want people to come in and ask questions, and just have a conversation about this stuff. And I'll probably keep doing webinars like that, just so people can come in. Eventually, you got to, my community is what I'm building, so I can do it all in there, But, I'm just this here. People are starting to listen and look at it. It's been a year that I've been doing this, and I plan on keep on doing this because I want to get this into people's hands. Especially these ones that when this new uh, big bill, whatever, I forget what he calls it, big beautiful bill. Beautiful for some people, but some people it's not going to be beautiful. And when you lose your health insurance, you're going to need some way to take care of your situations. And I feel bad. I see people, and like a lady has, her son has, I guess it's autism or whatever, but I've been seeing this kid for a while, and I've been wanting to say something. I finally got to say something. I started interacting with her, and she backed off. So that's a shame because one medicine, two medicines, I hit the right medicine for that child, and you'll see him things clear up. Yeah, it's sad I know what I have. I have gold in my hands, and I want to offer it to somebody. And it's for free. I was offering it for free. I will work on that child for free, and they still, nah, they're not into it, So I don't know. It's a sad thing. So my goal is just to get it into everybody's hands, get them to understand it. At least they have knowledge about it. They can go find a homeopath. There is homeopaths around. I don't want to be one. I'm a lay person. I just want to educate people on homeopathic medicine and eventually send them to homeopaths. And the ones that want to become a homeopath, I can send them to schools that these guys produce. But my goal is to get the kits in your hands, maybe a couple books and some knowledge so you know how to help your family through any crisis or situation. So, all right, that's enough of that off my soapbox. Now, let's do antimonium sulphuratum, golden sulfur of antimony. Remarkable. It says it's remarkable for chronic nasal and bronchial catarrh. So a lot of lungs and nose stuff, that post-nasal dripping things. Increase of tough mucus in larynx and bronchi. Respiration is difficult. So they're having a hard time breathing. They have bronchial catarrh from the lungs. They have nasal catarrh coming from the nose down into the throat and all that. So, what is amaurosis? I forget what, I'm not even looking it up. Amaurosis, but they have spots on the cornea, so it can be a good uh, uh, remedy. Sorry. Iris is protruding through cornea, so it can be a good eye remedy too. Pustular acne, good for skin acne. Loss of appetite, almost loathing of food. Hmm. Yeah. Anyways, almost loathing of food. They just don't want to eat. Urine is increased, dark and red. Now lungs. Winter coughs. Patient is sore all over. So this could be a flu type of thing. Pneumonia. Oh, could be a pneumonia type of thing. Sputum mixed with blood. Tubercular. I would think of tuberculinum for that. Of sweetish taste. So there's a few medicines for all this. This is one of them. Difficult respiration, dry hard cough, no expectoration with that cough, so nothing's really coming up. Could be a COVID type of thing, what was going on with people. Congestion of upper lobe of left lung. So if they feel it more in the left lung, this would be definitely, that gives you a better indication for this remedy. Tickling in larynx, increased mucus. So a lot of mucus, lungs, nose, all that. They got a tickling in the larynx, probably what's producing the coughs. And the coughs are definitely, if you got someone with a winter cough, this would be more for that. And there's a few other ones that would be more of a summer cough. With fullness, increased mucus with fullness in bronchioles and pressure with constriction. So a lot of constriction, a lot of fullness, a lot of mucus, all that stuff going on. Pustular eruptions on scrotum with much itching. So they got eruptions on their scrotum. Pasty mouth and taste in the morning. Pasty, like dry, I guess, with, yeah. Anyways, nosebleed on washing. So when they wash, take a bath, whatever, wash their face, they tend to get a nosebleed. That's an interesting indication there. Increased secretion in nose and throat. And they have a loss of smell. Now that was going on with COVID. Loss of smell, loss of taste. Now this doesn't say loss of taste. I think antimonium tart, that was the one I was using. It said loss of taste and loss of smell. So I used that and a lot of mucus and all that stuff. So I used that to keep it out of my lungs, you know. And I worked 12 hours a day for 2 weeks till they figured out I had COVID. you know. Acne, pustular variety, itching on hands and feet. Now, when I took that antimonium tarp, it didn't take away all the symptoms. So I obviously was just palliating it, but it kept it out of my lungs. My lungs weren't as bad. I had the chills, the fevers, all that kind of stuff, but my lungs didn't fill up. Acne and pustular variety, which is a pustular variety, itching on hands and feet. Okay. So itching on the scrotum, and they got what they got? Pustular eruptions on the acne on the face and stuff, probably on the hands and feet. So, uh, stomach pressure and fullness in stomach and the abdomen. So a lot of fullness in stomach and abdomen with pressure in there in the umbilical region, so right around the belly button down in that area. Uh, so stool, much flatus with sudden urging. So they gotta run to the toilet. That could be in a pneumonia, flu, whatever's going on. Stool is solid. Then it becomes bright yellow and pasty. There's that pasty again. Pasty in the mouth, pasty stools. Afterward, violent colic and rumbling. So after they have these stools, they're hard. Then they turn bright yellow and probably like a diarrhea, pasty type of thing. Afterwards, not fully liquidy, but just pasty. Afterwards, violent colic and rumbling in the stomach. Constipation. Now, when they have constipation, the feces are hard and passed with difficulty. So there's that constipation. So it can be either way, depending on the stage of disease, I would imagine. Throat, increased secretion in nose and throat. So that's the big one here. A lot of mucus. Rough, scrapey feeling, and you would ask, what's your throat feel like? It feels rough and scrapey. Metallic taste in the mouth. Burning heat in faucets. You'd be surprised how metallic taste, you don't think, well, what's that mean? Why is it, that can be difference between one medicine and another. Burning heat in fauces or the throat area. Mucus in the throat is offensive, so it smells. Pressure like a plug stuck in the throat, and it's scratchy, rough feeling in the morning. So there's that scrapey, scratchy, rough feeling. So that is antimonium sulfuratum, antimonium sulph-auratum. I don't know why I didn't put sulfur, but they just have sulfuratum. So, and that's golden sulfur of antimony. I I didn't look up what that dang thing was. I didn't really care. I wasn't looking to do that. So all this sounds technical. Sounds like I really know something. I was on a call yesterday and I was trying to figure out how do I make a clickable link, what do they call it, hyperlink on YouTube with this thing, and or no, it was something else. Oh, putting it in my community, that's where it was, and trying to put it into my community. I basically had to put in the word, and it was antimonium muraticum, and the guy said, "What are you talking Greek?" And it's just a term for mercury of antimony. You know, these are just chemicals, and the chemicals basically are not even there. They're diluted out so far. But this is the substance that was being used, and they were like, "What are you talking Greek?" And people would say that. Now, if you think I'm talking too technical, you don't understand. Yeah, I understand that. And it's, it's not, if I say arsenicum instead of arsenic, give them arsenic. I always like to say that. My wife had a headache when, I come home from work, and I asked her what was, she says burning. I said, "Oh, I gave my wife arsenic, never had to worry about the headache again." Now she still gets headaches and that, but I gave her arsenicum, just because of the simple fact of burning, and it can be quite just that simple. And sometimes you could be, you know, confused. Now, I had a thought yesterday. I was helping a bee lady. I was scraping, and while I'm scraping, that's why I like to do manual, menial things. I thought, you know what? I wonder if it's a lack of magnesium, because when you have a lack of magnesium, you have cramping and pain in your thighs and calves and things like that. I gave her some last night. Did it help? She said, "Oh yeah, wonderful." Well, she still, I went in this morning. Now the dog was up because of the fireworks. I went in this morning, and she's still. So I watched her. I laid in bed and studying my stuff and watching cartoons. Yeah, buddy, like cartoons. So I'm standing there. I'm reading that, watching her, and she just keeps moving her legs. So that's an indicate. That's a keynote that I can use. Wants to constantly move the legs, throbbing in the leg. What else is there? Yeah, that there's just throbbing, and you got aching. It aches, and but she says it throbs. So I got throbbing, constant moving of legs, worse at night. Definitely worse at night, because now in the day, for some whatever reason, I don't know if it's always the animals, because Smokey wants to go to the bathroom at night, and last night I imagine she had a hard time with some fireworks that were going off. But she will sleep the day away, and then she'll wake up and be good for the night. And when it's time to go to bed, now when she's moving around and walking, so that could be better by movement. That could be bryonia. I never thought of that. That was the first time I thought of that. So better by movement, yeah. And this the key, is the keynotes, bryonia, better by movement. So if I think of, or Russ talks, I'm sorry, Russ talks is better by movement. Now when she gets up and she moves around, she's, and I have Russ talks in my preview of medicines. Russ talks, there's a Kelly carb, magphos. These are ones, and calcarea carb. I have a handful of medicines that I'm considering. I've given her a cal carb. I've tried Russ talks. Did I not stay on it long enough? Now that's the other thing that Robin says. You're not getting results right away, and you change medicines. Why? The person's starting to feel better. It seems like it's working, and that was with cal carb. She said cal carb seemed to help her. But then when it doesn't work, there's a couple things that go on. You can either give a like sulfur or but cal carb's already polycrest, a bit major polycrest. You can give sulfur to get it moving, and then go back to cal carb. You could change potency. So these are the few things that can throw a whammy in. But I've found that most of the time, like my son, I've got, "Dad, they said I've got bad spleen or whatever." And I said, "What's the symptoms?" He said, "Well, I have constipation, um, don't want to eat, and I'm real weak and tired and just can't function." And he looked weak. Now that could be gelsemium, but I'm thinking constipation. And I looked it up, and aluminum, it came down. I gave him that, and it cleared it up. So it can be that simple, but then some things can be quite difficult, So yeah, it would be easier if I just went and said that went to the doctor. They gave him a spleen, whatever they give for the spleen problem, and go that way. But then there's side effects and things like that. That makes it easier. But when you're sitting there, and you're looking at a person and you're observing what's going on with them, and that's why I'll sit there and I'll observe what's going on. I got to give my mother arnica. You know, I put it in her. They won't take my medicine. I put it in her jug of water, and I don't get to pound it, but you know what? As long as it's in there and she gets it, that will help clear up any head injuries she had from falling down steps and that, and from a car accident and different things. I'll probably keep dosing her with arnica every so often. Just throw it in her bottle or drink container and let her go that way. So, but my goal is to get this into people's hands because you'd be surprised at the things that it can help you with in your daily life, you know, different things and chronic situations. You know, got something that the doctors just can't figure out or can't help you with. This can probably do it. So, as usual, you can age, but you don't have to get old.